Prostate cancer can be treated in many different ways. We'd like to think that curative therapy is the first choice, but we have different palliative treatment methods also. However, patients having a local prostate cancer should be treated with curative therapy as their first choice alternative. What alternatives do we have if we have a cancer in the prostate, like this one here? Well, we can either operate and do the surgical radical prostatectomy. Radical prostatectomy with surgery can be done either with open technique or it could be done with laparoscopic technique. The laparoscopic technique can be done either with traditional long instruments into the body or with robotic assisted laparoscopic prostatectomy, the most common laparoscopic method today. If surgery is not an option, then radical radiotherapy can also cure a patient with prostate cancer. Radical radiotherapy to the cancer can be given either through external radiotherapy from the outside of the body to the inside, or it could be given with the technique called brachy technique. That is local radiotherapy inside the prostate directly on the cancer. Patients that cannot be cured or choose not to be cured with these two methods can be given palliative treatment if they have symptoms of their cancer. Palliative treatment means that we try to reduce the activity of the cancer so it kind of shrinks away. How can we do that? Well, cancer cells of the prostate, they really love the testosterone in the body. Testosterone is like food, like getting a hamburger or a pizza if you're a prostate cancer cell. So, how do we get rid of the testosterone effects on the cancer cells? There are many different ways of doing that. Testosterone comes from the testicles. It is produced in the testicles and a little bit also in the adrenals. So, if we want to get rid of the production of testosterone, the easiest way is really to just take away the testicles. That is called ablatio testis, or bilateral orchidectomy. So we have to take away all the testosterone producing tissues within the testicles. Another method is to affect the production of luteinizing hormone coming from the pituitary gland. That also stimulates the production of testosterone. So in patients that don't want to have their testicles operated, we can give a hormone called gonadotropin releasing hormone coming from the hypothalamus. Gonadotropin releasing hormone agonists, these hormones are really strong hormones. They are so strong so they really bind into the pituitary gland, sit there and just block the effects and the production of more LH from the pituitary gland. And if the pituitary gland do not produce any more LH, there will be no stimulation on the testicles, there will be no testosterone, and the patient will be medically castrated. Another method of reducing the GnRH and turning down this axis is to give estrogen to the man. Estrogen is the female hormone, and if we give estrogen, then this axis will slow down and turn off, and there will be no more production of testosterone. Then we have the last option, and that is to block the effects of testosterone directly on or inside the cancer cells. This can be done with a hormone called antiandrogen. Antiandrogens are common today, and they block this receptor, so the patients still have their testosterone going around in the body, making the man feel a little more like a man than if the testosterone is totally gone, like it is with the other methods. So antiandrogen is a good option. Today we have a couple of really strong and good antiandrogens with their effects down here. That is also expensive medicines, but they are getting more and more common in the treatment of prostate cancer today.